Unlock your health potential. Learning to identify root cause number 21, sluggish colon motility. Cultural taboos tell us that what happens in the bathroom should stay in the bathroom. As a result, our colon, and by extension our poop, really don't get the attention they deserve. The colon, also called the large intestine, is a crucial part of the digestive system that often doesn't get the attention it deserves. While many of us are aware of the stomach and small intestine's roles in breaking down food, the colon is equally essential in maintaining our body's inner balance and overall health. Your digestive system is a group of organs that work together to digest and absorb nutrients from the food and liquids you consume. Your digestive system also takes care of food waste, the stuff that's left over after you digest food. It turns food waste into stool. The main parts of your digestive system are your gastrointestinal tract, also referred to as GI tract, and your biliary tract. The GI tract is a series of hollow organs that connect to digest and move food through the body. The biliary tract makes and releases fluids that help digestion. Your GI tract is a long tube that runs from your mouth to your anus. If you could stretch it out, it would measure 30 feet. It's shorter in your body because your intestines, the longest parts of the tract, coil up in your lower abdomen under your stomach. Your GI tract parts include the mouth. This is where digestion begins. The esophagus. This is a tube in the center of your chest, behind your windpipe and in front of your spine. The stomach. Your stomach sits in your upper abdomen on the left side of your body. The small intestine. This 22-foot-long muscular tube is the longest part of your GI tract. It coils up in your lower abdomen and curves around your pancreas. And the large intestine. The last step in the digestive process, the large intestine includes your colon, rectum, and anus. Your biliary tract is in your upper abdomen. Organs in your biliary tract support digestion by delivering bile and enzymes that help your small intestine break down food. Your biliary tract includes the bile ducts. You have bile ducts inside and outside your liver. They connect to your gallbladder. The gallbladder. Your gallbladder is tucked below your liver on the right side of your body. The liver. An organ and a gland, your liver is on the right side of your body under your ribs. And the pancreas. This organ is behind your stomach and in front of your spine on the right side of your body. When you eat, food enters your digestive tract. This is a series of organs that form a pathway from your mouth to your anus. As food moves down this pathway, it is processed and changed to waste. The nutrients are absorbed in the body. After food is changed to waste, it is pushed out of your body in a bowel movement. The stomach breaks down food into a liquid mixture. The small intestine absorbs nutrients from the liquid mixture. What remains is liquid waste. The colon absorbs water from the liquid waste, converting it into solid waste. Nerves along your digestive tract tell your muscles how fast to contract. Muscles in the intestines contract to move food and waste through the digestive tract. The rectum stores stool until a bowel movement happens. The anus is the opening where stool leaves the body. The colon, also known as the large intestine, is the last major organ in the gastrointestinal tract. It plays a critical role in regulating the frequency of defecation and consistency of stools. The colon lining consists of sensitive nerves and glands that help in the absorption of food, especially some vitamins, minerals, water, and enzymes. During the course of the day, your colon will also eliminate unhealthy, unwanted substances in the waste area of your body in the form of bowel movement. Primary functions of the colon include: the colon absorbs water and electrolytes from indigestible food material, helping to form solid stool. It absorbs vitamins produced by colonic bacteria, including vitamin K and certain B vitamins like biotin. It forms and stores feces for elimination, with the descending and sigmoid colon serving as storage areas. It propels fecal matter toward the rectum through coordinated muscle contractions. It hosts a complex gut microbiota that ferments indigestible food components, producing short-chain fatty acids that support colonic health and immune function. It regulates electrolyte balance by absorbing or secreting ions like sodium, potassium, and chloride as needed. And it plays a role in immune function by housing immune cells and maintaining a protective barrier against pathogens. Everybody poops, but nobody really talks about it. But while putting a lid on all potty talk may keep conversations civilized, it may mean we're missing out on valuable clues to our health. Every bowel movement provides insights into your body's functioning, revealing what's working well and what might need some attention. So whether you're new to talkin' poo or you're a Bristol stool scale pro, we hope to inspire you to listen to your body and get comfortable taking on a look at your poop. By the time food reaches the large intestine, most of its nutrients and water have already been absorbed. Any leftover material, along with some dead cells and other bodily waste products, is what becomes your poop, and your body needs a way to get rid of it. The waste makes its way to the end of the intestines before exiting the body through the anus as stool. Your body efficiently uses what it needs and gets rid of the excess. In other words, poop is the visible evidence of your body's complex internal processes. Your body efficiently uses what it needs and gets rid of the excess. And that's why everybody poops. If you're still thinking, yuck, why are we talking about poop? Consider this. Without the ability to eliminate your bodily waste through bowel movements, that waste would build up inside you until your body was so full of poop, you simply couldn't function. And that would indeed be gross. A normal bowel movement typically occurs between 3 times a day and 3 times a week, with healthy stool being soft, well-formed, and easy to pass, light to dark brown in color, has a mild odor, and sinks in the toilet. Factors such as fiber intake, hydration, physical activity, stress, and medications can influence bowel habits, and occasional changes are common and usually not concerning. However, persistent changes in frequency, consistency, color, such as red, black, pale, or green, or the presence of blood, mucus, or severe straining, may indicate an underlying health issue and warrant medical evaluation. The Bristol Stool Chart was developed in 1997 as a clinical assessment tool. There are 7 types of stools according to the Bristol Stool Chart. It's widely used as a research tool to evaluate the effectiveness of treatments for various diseases of the bowel. The chart is used to describe the shapes and types of stools. It is also used as a tool to diagnose constipation, diarrhea, and irritable bowel syndrome. What you see in the toilet bowl is basically the result of your diet, fluids, medications, and lifestyle. You can use the Bristol Stool Chart to check what your stools are telling you. The Bristol Stool Chart shows 7 categories of stool. Every person will have different bowel habits, but the important thing is that your stools are soft and easy to pass, like types 3, 4, and 5 shown here. Health practitioners use this chart in diagnosing the cause of constipation, diarrhea, or other symptoms. They typically ask you to look at the chart and point to the number that most closely matches the look and form of your bowel movements. Each type signifies a different story about your health, especially your digestive system. For example, types 1 and 2 often signify constipation, while types 6 and 7 suggest the other extreme, diarrhea. Types 3, 4, and 5? Those are your Goldilocks stools, just right. Understanding your stool using the Bristol Stool Chart provides fascinating insights into your health. It is like your body's not-so-subtle way of waving a red flag when things aren't quite right. For instance, frequently finding yourself at the extremes of the chart could mean you are not getting enough fiber or perhaps are stressed or dehydrated. This chart is an excellent tool to help you tune into your body and detect potential early warning signs. If you spot persistent irregularities, it is crucial to seek advice from a health professional. The color of your poop generally reflects what you consume, whether that's food, beverages, or medicines. While brown is the most typical color, there are other colors we may see in the toilet. Here's what the color of your poop might mean about your health. Black poop. There are a few reasons why your poop may be black, including taking iron supplements or bismuth medication like Pepto-Bismol. But black stool can also mean that you have bleeding in your upper GI tract. Any internal bleeding is an issue, so if you can't figure out why your poop is black, make a primary care appointment right away. Green stool. If your poop is a little greenish, it's totally fine. Green poop may signal that your food isn't spending enough time in your digestive system, or that you're eating a ton of leafy greens like spinach. And if your poop suddenly looks like neon green Play-Doh, the likely cause is artificial colors from drink mixes, bakery frosting, or frozen novelties. Red stool. There are dietary reasons why your poop may turn red, such as beets, cranberries, red gelatin, or tomato juice. But red poop can be a cause for concern because it may mean you have bleeding in your colon. This can be a sign of colon cancer or digestive disorders. Bloody stool may look coated in red, or you may notice spots of red in it. If you can't explain the red color by your food choices, get in touch with a primary care doctor. Yellow stool. If your poop is yellow, greasy, and stinky, it probably means that you've been eating too much fat. But sometimes it can be a sign of malabsorption, which means that your body isn't able to pull nutrients from food during digestion. Malabsorption usually happens due to sickness, food intolerance, or diseases that affect the intestinal lining. Pale or white stool. Chalky is not a good look on poop. It may mean your body isn't producing bile. It could be that you have an infection or that your bile duct is blocked. Pale poop could also be a side effect of medicines, including some used for diarrhea. If there are white bits of a foamy or jelly-like substance in your poop, it could be mucus from your digestive system. A little mucus in your stool is okay, but if there's a lot, you'll want to talk to your doctor about that too. Not sure if your normal is normal? Let's explore a few more poop indications you should be paying attention to. The most normal time to poop is in the morning after your body worked overnight processing your food. But there's nothing wrong with having bowel movements at other times of the day. It should take just a couple minutes for you to have a bowel movement, certainly not more than 10 to 15 minutes. If there's pain or straining to get your poop out, you're probably constipated. People often wonder if they're pooping too much or too little. The truth is that everyone is different. For some people, it's normal to go 3 times a week. For others, it's normal to poop 3 times a day. The frequency of your bowel movements is usually only a problem if your stools are too hard or very runny. If you're producing soft, well-formed logs that aren't hard to push out, your bowels are probably in good shape. The process of foods breaking down in the colon makes poop smell. Unfortunately, it never smells like a bouquet of roses. So if your poop stinks, you're in good company. But if the smell of your poop makes your eyes water, that's not normal. Most likely it's due to an infection or a stomach bug, and your stinky poop will go away after you get better. Foul-smelling stools that float can be a sign that your body isn't effectively absorbing nutrients. If this persists, it could be a sign of a food intolerance, celiac disease, or a pancreatic insufficiency. A random midday loose movement is nothing to get nervous about. We've all had a meal that just didn't agree with us or an anxiety-inducing experience that sent us running to the toilet. However, if you have loose or very watery stool for several days, that is associated with blood, fevers, or cramping, it's time to contact your primary care doctor. And last, your poop should sink. If your poop occasionally floats, it's probably nothing to worry about. But if it becomes a regular pattern, it could indicate that food isn't being properly broken down or absorbed in the body. If your stool has a mucus-like quality or it looks like there's oil floating in the water with it, there may be an issue with the upper intestines or pancreas. Sometimes this will be accompanied by an extremely foul smell. This is another reason to contact your primary care doctor. Sometimes a bad bathroom experience is just the result of a bad dinner decision. These things happen even to the best of digestive systems, but there are times when your symptoms may indicate a bigger problem, and you should seek professional advice. So watch out for the following changes in your bowel habits that last longer than a few days. Recurrent constipation, recurrent diarrhea, very thin or skinny poop, severe abdominal pain and indigestion, poop that is always very stinky and often floats, unexplained weight loss, red stools or black stools that cannot be explained by your diet. Health concerns associated with sluggish colon motility. Colonic motility dysfunction refers to a disorder in the normal movement of the colon. The 2 primary symptoms of colonic motility dysfunction are constipation and diarrhea. Additional symptoms include intermittent abdominal cramping, straining, urgency, a feeling of incomplete evacuation, bloating, measurable abdominal expansion, and worsening of symptoms after eating a meal. The reduced motility can also lead to vitamin deficiencies and autoimmune conditions if it results in small intestinal bacterial overgrowth, which can cause bloating, pain, and diarrhea. The most common cause of abnormal movement of your colon is one you can control, namely your diet and lifestyle choices. Eating too few of the foods that keep your digestive tract moving, like high-fiber foods, can affect your stools. Lack of exercise, a sudden increase in exercise intensity, not getting enough water, and stress are also common causes. Bathroom visits usually return to normal once you change your habits or adapt to a new routine. Medications are also a key culprit. Many over-the-counter and prescription medications have side effects, like diarrhea and constipation. Stools usually return to normal once you stop taking the medicine. Also, multiple conditions can cause changes in your bowel habits and stools, including celiac disease, colon cancer, colon polyps, food intolerance, hemorrhoids, inflammatory bowel disease, irritable bowel syndrome, liver and gallbladder disorders, neurologic conditions, pancreatitis, and weak pelvic floor muscles, to name a few. Ignoring bowel movement issues can lead to significant health complications that extend beyond the digestive system, impacting overall well-being and increasing the risk of serious conditions. Chronic constipation and irregular bowel movements are associated with an increased risk of developing colorectal cancer due to prolonged exposure of the colon's lining to waste products and toxins. Fecal impaction, a severe complication of chronic constipation, can lead to bowel obstruction and potentially bowel perforation, which are medical emergencies requiring urgent treatment. The accumulation of toxins in the colon from infrequent bowel movements may disrupt gut bacteria balance, contributing to weakened immunity and potentially influencing mood disorders. Bowel movement issues, particularly fecal incontinence, can result in skin irritation, rashes, and infections if stool remains on the skin for extended periods, posing additional health risks. Persistent digestive problems can lead to systemic complications such as dehydration, electrolyte imbalances, and malnutrition, which affect overall bodily function. Mental health is also significantly impacted, with chronic bowel issues contributing to depression and social withdrawal due to embarrassment and fear of accidents.
Imagine discovering that the real power to heal has been inside you all along. Introducing Unlock Your Health Potential. This groundbreaking guide reveals how to move beyond chasing symptoms and instead uncover the true root causes behind your fatigue, mood changes, chronic aches, and other long-standing conditions. so you can finally experience the lasting relief and vitality you deserve. This book is a treasure trove of practical information. It offers the guidance and confidence you need to take charge of your well-being, break out of the vicious cycle of declining health, and rebuild the vibrant life you deserve.
To summarize, your digestive system is a group of organs that work together to digest and absorb nutrients from the food and liquids you consume. The colon, also known as the large intestine, is the last major organ in the gastrointestinal tract. It plays a critical role in regulating the frequency of defecation and consistency of stools. The colon absorbs water and electrolytes from indigestible food material, helping to form solid stool. It hosts a complex gut microbiota that ferments indigestible food components, producing short-chain fatty acids that support colonic health and immune function. It absorbs vitamins produced by colonic bacteria, including vitamin K and certain B vitamins like biotin. It forms and stores feces for elimination, with the descending and sigmoid colons serving as storage areas. It propels fecal matter toward the rectum through coordinated muscle contractions. A normal bowel movement typically occurs between 3 times a day and 3 times a week, with healthy stool being soft, well-formed, easy to pass, light to dark brown in color, has a mild odor, and sinks in the toilet. The 2 primary symptoms of colonic motility dysfunction are constipation and diarrhea. Additional symptoms include intermittent abdominal cramping, straining, urgency, a feeling of incomplete evacuation, bloating, measurable abdominal expansion, and worsening of symptoms after eating a meal. Reduced motility can also lead to vitamin deficiencies and autoimmune conditions if it results in small intestinal bacterial overgrowth, which can cause bloating, pain, and diarrhea. The most common cause of abnormal movement of your colon is one you can control, namely your diet and lifestyle choices. Ignoring bowel movement issues can lead to significant health complications that extend beyond the digestive system, impacting overall well-being and increasing the risk of serious conditions. If you experience irregular bowel movements, passing stool often fewer than 3 times a week or alternating between constipation and diarrhea, hard and dry stools or difficulty evacuating stool, excessive gas, bloating or visible swelling of the belly, cramping, discomfort, or tenderness in the abdomen, presence of mucus in stool, rectal bleeding, brain fog, poor concentration, poor memory or mental confusion, excessive fatigue, impaired immune function, skin problems, or lower back pain, your colon motility might be sluggish. Remember, suppressing a symptom may ease your suffering and help in the immediate moment, but it never gets to the underlying cause. This approach does not take into account your body's natural self-healing mechanisms and causes long-term dysfunction. Thus, it is best to think why, how, and mechanism of various conditions, rather than focusing on the condition itself. Looking for tips and strategies on how to confirm and resolve this root cause? Our book, Unlock Your Health Potential, offers a comprehensive guide for how to confirm, address, and resolve the 24 major root causes discussed in this video series. For immediate actions you may take now to kickstart your healing journey, check our Master Your Health in 8 Weeks program. We hope you enjoyed and benefited from this short video. For a list of supporting references and resources, check this video description below. Please remember to like and share this video. May you achieve your health goals and experience joy, resilience, and optimal health.